welcome. We want to welcome you to the Baldwin County Leadership Response to COVID-19 press conference. My name is Jenny Gary, and I work with Baldwin County Commission. Today, we have leadership available that we will be discussing updates in our community related to the coronavirus. I want to thank you for joining us, and I would also like to remind you that for this meeting, those in this room, if you would please mute your cell phones. Today, our participants that will be speaking, we will have Jenny Kilpatrick with the Alabama Department of Public Health. We have Zach Hood, the Director for Baldwin County Emergency Management. We have Commissioner Billy Joe Underwood with the Baldwin County Commission. We have Sheriff Hoss Mack with the Sheriff's Department. We have Superintendent Eddie Tyler with the Baldwin County Board of Education. We also have Miss Donna Watts. She is with the Baldwin County Chamber Coalition. We also have Herb Malone with the Gulf Shores and Orange Beach Tourism. Upon the conclusion of the speakers, we will open up the floor for questions. So at this time, I would like to begin by introducing our first speaker, which will be Jenny Kilpatrick from the Alabama Department of Public Health.
Thank you, Jenny. I would like to introduce today our Assistant State Health Officer for the Alabama Department of Public Health, Dr. Karen Landers. She'll be joining us via conference. She has worked with the Alabama Department of Public Health for over 37 years. She is also currently our medical consultant for tuberculosis control and immunization, our pediatric consultant, pediatrician, and public health officer, and media spokesperson. So I'll turn it over now to Dr. Landers. Thank you.
Dr. Landers, are you on the line? Yes, I am. Okay, you've just been introduced. Thank you. Okay. So, would you like me to give a brief statement, or what would you like for me to do?
Yes, please. Thank you, Dr. Landers.
You're on live now. Okay. All right, well, first of all, I'm Dr. Karen Landers with the Alabama Department of Public Health. I'm one of the physicians that's working on the COVID-19 response in the state of Alabama. And as we all know, this continues to be a situation of concern and of public health importance. And I think the most important message that we can provide today to the general public, as well as you all as leaders of the community, is that this respiratory virus, this virus that is spread by respiratory droplets from person to person and by talking or sneezing, these are the primary ways that it's spread, and the most important ways that it is spread, is that right now we can take measures as a community and as a state to reduce the transmission by the measures we've already talked about, such as respiratory hygiene, hand washing, cover your cough, stay at home when you're sick, take the advice of your doctor in a situation like this, especially persons that are elderly and immunocompromised need to be following up with their doctors in terms of not only restriction of their activities, but also keeping their medications and supplies up to date at home, as well as being sure you're up to date on your flu shot, and finally keeping your environment clean. These are all measures that we can do in terms of respiratory hygiene. In addition, as we have seen more cases of this in Alabama, as well as other states in the nation, more information has been provided related to social distancing. And just last night, I was listening to Dr. Anthony Fauci, who is one of the most respected experts in the world on infectious diseases, talking about social distancing and the importance as we look at what's going on in flattening the curve. And by flattening the curve, I mean reducing the spread ahead of this by taking these measures of social distancing. And again, I won't outline every one of those, as those are on our website as well as in our news releases, but just reminding us that right now, with the loads of virus cases that we have in Alabama, implementing the respiratory hygiene or continuing the respiratory hygiene and implementing the social distancing will help us in terms of reducing the transmission of this virus. So again, avail yourself of our information on our website in terms of the guidance of our state health officer, Dr. Scott Harris, regarding social distancing in Alabama. And just good examples of social distancing are really travel now. You really need to reconsider whether or not you need to be traveling. Work from home if you can. If you cannot work from home, if your job does not allow you to be able to work from home, for example, I'm a physician and work in the state health department, so I'm not able to work from home. But take the measures to social distance from people. In other words, keep your distance of about 6 feet. Keep your hands clean. Do those respiratory hygiene measures that we've already talked about. Now, our case counts are changing as we are detecting more cases in Alabama, and this is expected. We will see more cases. Our website is updated twice a day. That is related to the laboratory tests that we do in our Bureau of Clinical Laboratories, as well as commercial labs, private labs that report to us. Private labs are required to report to us within a 4-hour time frame, as COVID-19 is a reportable disease nationwide, and of course we're talking about the state of Alabama. It is reportable in Alabama. What do we do when we receive a positive test? Well, we go through what's called an epidemiologic process or an investigative process to determine within a time frame prior to that person becoming ill of approximately 14 days where this person has been, what this person has been doing, what their work activities are, what are their close contacts. And again, we want to continue to remind ourselves that persons that are in very close contact, such as their household members, would be more likely to be infected by them with this virus. Again, the incubation period being 2 to 14 days, with somewhere in the middle range being the most common. So again, going back to what we do is an investigative procedure, and I don't want to outline that unless people have questions, just because it is a bit lengthy and that would take time that you all might want to be using on your planning and your preparation. But we do have an investigative procedure. Persons who have COVID-19 and their close contacts are told by the health department they will receive a letter from the health department. They are to stay at home. They are not to engage in public activities. They are not to go out until such time as their illness has resolved. They are advised what to do at that point in terms of being out into the public again. So again, they are under basically a home quarantine, if you will, and they do receive those instructions from the Alabama Department of Public Health. Now, I want to take a moment right here to remind people that certainly close proximity and being able to exchange those respiratory droplets is really what we are most concerned about at the moment in terms of transmission. But if persons have been to very large events, like in a very large arena or something like that, it's really more about your proximity to the persons that are sitting next to you than it is the proximity of just being in a building, okay? Because again, the way respiratory droplets are spread. However, if persons have been to events or situations of that nature, then, we will provide information related to that so that persons can take measures. Although really right now, again, to remind people as part of an investigation, that it's extremely important that we be aware, and that's part of the social distancing of going to large events. And you know that discussions have taken place regarding the size of events, and that's on our website, as well as making sure that persons that are very, very, very high risk not be involved in such events. So again, limiting those crowds, limiting the size of events will go a long way toward the reduction of that. So I've talked about some general information. I've talked about the ways that we can, as as a public, as a community, reduce this virus. And I've talked some about what we do if we have a positive. Now let's talk just a moment about specimen collection and testing. And I don't want to take too much time on that, but to remind people that the social distancing and testing is extremely important. I think I have a message here from Sherry. Sherry, did you want me to stop for a moment?
If you don't mind, we're gonna come back to you in just a moment for questions.
Okay, all right. I'm sorry. I wasn't sure. I was talking without checking my phone. So again, yeah, I'll be happy to do that, Sherry. And thank you so much. I realize it's a little difficult sometimes doing this over the phone. Thank you.
Thank
I'm
you.
going to go to the mute button. Thank you.
Thank you, Dr. Landers, for providing us with that update. At this time, I'd like to introduce our next speaker, which will be Zach Hood from the Baldwin County Emergency Management Agency.
Good afternoon. I'm Zach Hood, the Emergency Management Director at Baldwin County EMA. I'm honored to have you join us today, and it's overwhelming support from the community has been incredible to see as we help each other get through these difficult times. Just like you, I myself have been taking same precautions and protecting not only me, but my family as well. And I ask for your continued support in support of our public health partners and the messaging that they are passing along for our county to follow. My background is emergency management, and in emergency management, we have always known the possibility of dealing with infectious disease is real. We are familiar with dealing with infectious disease, and we are familiar with working with the Alabama Department of Public Health on these issues. As we move forward, we are continuing to strengthen our relationship and work together toward common goals set forth by the Alabama Department of Public Health. At the Emergency Management Agency in Baldwin County, we are monitoring and looking at 7 lifelines, critical lifelines here in our community. They are as follows: safety and security, food, water, sheltering, health and medical, power and fuel, communications, transportation, and hazardous material. What we do with these lifelines is we evaluate them to determine what or where is the greatest need for support from emergency management. I would like to point out all, with the exception of one of our lifelines, are green. These lifelines are rated either green, which is good, yellow needs attention, and red really needs support, resources, and our expectation is that our immediate needs and resources are addressed to those that are red immediately. As you will notice, health and medical in our community is identified as yellow. And what I ask as an emergency management director for Baldwin County is that you help us achieve the status of green with health and medical by following the guidelines set forth by the Alabama Department of Public Health. We can come together and do the best good if we follow the guidelines that our partners have given us to follow. We will continue to evaluate our 7 critical lifelines, and hopefully next time that we speak, we can improve the status of our current lifeline. We know that all of you are impacted, and we appreciate you taking the opportunity to not only join us, but helping us share one consistent, concise information about our community in our community. Thank you.
Thank you, Zach, for those comments. Next, we have Commissioner Billie Jo Underwood. She will be our next presenter.
Thank you, everyone, for tuning in to this special press conference. As a representative of the Baldwin County Commission, I am Commissioner Underwood, and I would just like to let everyone know that we care about the people of Baldwin County, and by passing the local declaration for the state of local emergency, that was because we realized that we needed to take some action so that we can do what we can do to help contain this potential threat to the community. And we care about the people who come to Baldwin County, the people who live here. We've taken some measures with our own buildings. We've closed our buildings to public access, but we are still functioning as a government. So we still have everything available that can be done online or through the mail. And I would like to encourage everyone to exhibit kindness and respect during this time frame. Please stay tuned to our social media outlets. We have a full team here at the EMA, and our call center is pumping out really good information. It's the correct information that's coming down from the proper sources, which are the CDC, the Alabama Department of Public Health. We have a Facebook page, we have Twitter, we have Instagram, so whatever your pleasure is on that, please like our page, like the Baldwin County EMA page so that you can stay up to date. And all I'm asking is that everybody just, stay calm, wash your hands. I know that statement is getting, overused, but it is so important. I know we're in a state right now where everybody's scared to cough, everybody's scared to sneeze. We're more aware of our body functions, just that, standing here, I want to get my hair out of my face right now, and it's just so difficult. But you guys, we care about you. Call in to the COVID-19 hotline if you have questions about your health. And anything that we can answer, call into our call center. They're equipped to answer a lot of questions about Baldwin County. Thank you very much.
Thank you, Commissioner Underwood. Next, we have Sheriff Hosmack with the Baldwin County Sheriff's Department.
Good afternoon. I've been asked specifically to speak to law enforcement operations in our county. My honor to stand here today, not only representing the Baldwin County Sheriff's Office, but all of our law enforcement agency partners in Baldwin County. We've been in direct and indirect contact now since last week as we work to get the information out, but also manage different situations that come up. A lot of what we do is influenced by decisions made by other individuals. For instance, today, the governor of our state reset the elections for July the 14th. I was just notified a few minutes ago that the President of the United States has just signed another executive order that has a direct impact to the way that we handle evictions and some court processes through the courts, basically relieving those until May. And of course, earlier in this week, our presiding circuit court judge, in conjunction with all of our government officials, made the decision to close our courthouses to the public access. But behind that, there's a lot of law enforcement functions that still continue. We are still maintaining our normal routine patrols. We are still handling all of our call volume that comes in. We're still working with the court system on those situations that individuals do have to appear in court on. We're coordinating with our police chiefs. Any assistance that they may have, we're trying to push the information out as much as we can in all of those regards. I echo what Director Hood, Commissioner Underwood, and everybody's going to say. The reason we keep saying the same thing is we realize that we each reach different people. And the message is to self-comply with the recommendations. None of these recommendations that have been recommended, such as the washing of hands, the safe distancing of individuals, was just something that somebody thought of. This is based upon medical research and medical opinion, because what we're trying to do right now is slow this thing down, bring the curve down, if you will, maintain a spirit of calm. This is something that, if anybody's used to dealing with situations such as this, it's Baldwin Countyans. We've dealt with hurricanes. We've dealt with the BP oil disaster. We've dealt with other things, and we will get through this, and we will all be fine. But it takes that spirit of cooperation. So in that end, I'll conclude by saying this. If you have a situation that involves law enforcement, obviously if you have questions that need to come to us from law enforcement, Contact your local police department, contact the sheriff's office for those. If you currently have a case before the Baldwin County court system and you have an attorney, contact your attorney and let them find out when your court case will be reset. If you have a family member or friend that is in the Baldwin County Sheriff's Correction Center, we are still allowing visitation, but it's by video only. So you have to call the sheriff's office and arrange for that. If you have any other questions regarding law enforcement, once again, please contact them and we will work with you to get your answers. Thank you.
Thank you, Sheriff Mack. Next, I would like to introduce Superintendent Eddie Tyler with the Baldwin County Board of Education.
Thank you. I'm here speaking on behalf of our 7-member board for the Baldwin County Public School System. I know I'm going to try to give you as brief an update as I can. Most of our information we have shared with the public is on our BCBE website, on our social media website, Facebook. Everything that you could want to know about how we're cleaning our schools, how we're cleaning our buses, how we've gone about this process prior to shutting down school today. We did shut down a day early as far as students and teachers. They've all gone home. Our 12-month employees and others that are essential for the next couple of days through Friday are working at our schools, cleaning our schools. Also, our elementary schools are giving out over 16,000 Chromebooks. We do not allow our elementary school students to take them home overnight. They have them during the day. So they're being issued this week, and with any type technological devices, there's going to be glitches. So I'm asking parents, when you get these devices, if there's a problem, we do have a help desk, 251-967-5333, 251-967-5333. Call that number, and that's our help desk that can walk you through problems for your device. If that doesn't get solved, we ask you to contact your local school between now and 4 p.m. Friday for paper and pencil resource materials that you can take home and work. I want to remind everyone that from direction from the Alabama State Department of Education, what we're doing right now in the short term is practice. It's enrichment. It is not assessments. It's not grading. So parents, please just understand, use these devices, read what we've sent home from our curriculum division and our principals have shared, and give your students an opportunity to stay in touch with education. If it's a long-term situation, we have plans in place that we will address if this goes longer for distance learning. So we're working on that right now. We have those plans. But right now, things couldn't have gone smoother. I want to thank the public for their patience. You know, some of the safest places our children could be is in our schools. And we decided yesterday to send everyone home. So just understand that what we're trying to do is keep our parents and our students connected to the educational process. So if you have any questions, please feel free to call. As of Friday, schools will be all of our schools will be closed to the public. Our 12-month employees will go home. All of our 4,000 employees full-time will be on call. So at any time when something is needed, it goes through the chain to determine if someone needs to come to a school or to address an issue. So just understand that everybody is being taken care of, and we appreciate our board and we appreciate our 4,000 employees and how they've handled this. Thank you.
Thank you, Superintendent Tyler. Next, we have Donna Watts with the Baldwin County Chamber Coalition.
Good afternoon. Like Mack, I'm honored to stand here in front of you today representing the 5 chambers of commerce in Baldwin County. And very quickly for the public, I'd like to run through where those are. North Baldwin, Central Baldwin, South Baldwin, Coastal Alabama Chamber, and the Eastern Shore Chamber. So those 5 chambers of commerce serve Baldwin County. We're working together to be sure that we're ready and prepared to assist business with any resources that become available to them as this rolls along. We are getting, of course, information almost every day, multiple times a day. But we want to be prepared to help business with their business and to help them with their employees, because we understand that there will be probably loss of job as we move through this, depending on how much business we have to close. So we want to be prepared to do that. We're also trying to work together and come up with creative ideas so that our businesses can make the most out of this. Let's take restaurants, for instance. They're probably on the very front lines, restaurants and wait staff. And if you have not gotten your business prepared, your restaurant prepared, to do takeout only, you need to start that immediately. We have a page where we're doing a takeout blitz. Your chamber can direct you to that page. Any restaurant in Baldwin County that wants to be a part of that, let us know. We'll be happy to make sure you're on that page so that all of our visitors can find that, and all of our citizens. Herb, I believe, he'll be up next, but I believe he is going to help us push that out as well. So take part in that. But creative things that we can do. Turn your restaurant into a takeout. Make it speedy. Make it efficient. Take orders and payments online. If you haven't done that yet, please do it. And I think that's fairly simple for most restaurants to do. Folks, we are in this together. We are Baldwin Countyans, and we are strong, and we are accustomed to recovery and to responding, and we're resilient. So let's pull together, working together, keeping a good attitude, being kind to each other, and showing empathy and sympathy for each other, and helping everyone where we can will help get us through this, and we'll be stronger because of it. So thank you very much, and we'll take questions at the end.
Thank you, Ms. Watts, for those comments. Next, we have Mr. Herb Long with the Gulf Shores and Orange Beach Tourism.
Thank you, Jenny. Herb Malone, President, CEO, Gulf Shores Orange Beach Tourism. Like Donna and Hoss have mentioned, the memories of the oil spill come back to us right away. Different type of crisis, but one of the big common threads it has is we had never had that before. We can handle ourselves in storms. We've had a lot of experience on that. Oil spill was brand new to us. This event is also brand new to us, and makes the planning and the operations challenge. In normal times, our organization is in charge of the marketing of Gulf Shores, Orange Beach, Fort Morgan Peninsula area, and we have had great success in that since the oil spill. We've had record years back to back every single year since then. Most recent year of data, we hosted in Baldwin County 6.5 million people who, when they left behind, returned home, they left behind $4.7 billion. So you see, that's a tremendous economic force of this economy, of this county and the state. But the thing I focus most on is all the employees that work for the businesses that serve the guests, that serve the visitors. 53,000 people work in this industry. Many of them live in Baldwin County. So we have great concern for them. We move in a type of crisis like this, just like we do in a storm. We move away from being the marketer, put that on pause, and then we turn ourselves into helping extend the information out. We have a staff member that's been here practically every day at this facility. We have constant contact with the cities of Orange Beach and Gulf Shores and the county. So we want to make sure that what we try to do is get that information into the hands of our businesses so they can help inform their customers, and we all stay ready and directed. I'm sorry, I knocked the pen out down here. So our current situation right now today is we're in middle of spring break. That's about right now, our data tells us we're running about 70% occupied. It's not everything's not full, but it's about around 70%. Some of that is being added to by the fact that schools, colleges, and whatever, rightfully so, have closed, and those families can come and do what they do. Now, let me give you our definition of spring break. It's family vacation in the spring. It's not the debaucheries that we've seen on the movies. It's not a girls gone wild kind of spring break. Those people that partake of that sort of thing, and they're few, they're not, less than probably 5%, maybe 10 at the most. But they come to do that. Our police officers, the sheriff's officers, and what have you, they take care of that situation. There's been a couple of hot spots this year, but they're on top of it, and I know they will. And be known that we don't encourage that type of person, that type of guest, with those kind of intentions to come. We do have families with, it's not supposed to touch my face. We do have families with children. We have college kids that are very pleased to be here and know how to act correctly, excuse me, and they do not partake in any of the things I mentioned a while ago. So we welcome them each year. A lot of questions are, why are they still here? It's individual choice, individual freedom. These people have spent money to get here. They've made reservations some time ago. They chose that they're going to still come. It's their choice. Nobody's forced them. And while they're here, we want to make sure that they get the experience that they normally get when they get here, with the circumstances that we have today, as close to that as we can. Our businesses are catering to them, very much so. But many of them are implementing daily the recommendations of seating and other things, outdoor delivery, as Donna mentioned. So that's going on. We've had some restaurants that have closed. That's their prerogative. Attended the Orange Beach council meeting last night, the Gulf Shores council meeting Monday night, and they both are supportive of our local industries, and which, we don't have a lot of out-of-town kind of entities. We've got mostly many family-oriented, sometimes, second family, third family that own some of these businesses. They need our help, and Donna says we're going to help them all we can. So I believe that it's time for me to close and turn it over.
Thank you so much, Mr. Malone. At this time, I would like to share some important information with you. For those who have questions about the COVID outbreak, the Alabama Department of Public Health has posted a hotline. If you have questions about the illness or about testing, this is the number that you can call, 1-888-264-2256. And at this time, I think that we will welcome questions from our members of the media.
Can I ask Sheriff Mack, first of all, the governor has just come out, an article has just come out that the governor is considering closing the beaches. What do you, as law enforcement, and you've been down there and you've seen what's going on, and it's a mixed bag of things, because you've got state beaches, public beaches, Wild West down in Fort Morgan. What do you think should happen?
Well, I think we need to have, obviously they're reviewing this. We've been reviewing this for days. We've been watching it. As Mr. Malone said, we are in spring break. Spring break is going to continue for several more weeks that we have. Plus we have some local, our high schools, of course, are going to be on. So as far as if the governor does issue an order, of course, the details will be, is it going to be just the state access to the beach? Obviously, I think there's an issue. There's a lot of private beach in Baldwin County. For instance, if a condominium is sitting on a beach, that's a private access to that beach. Beach houses, things of that nature. So we'll certainly work with any order that we're given and do that. The way that would be implemented is a lot like we do during a time of a hurricane. We would give a notice We would say that by this order, this has happened. We would ask for self-compliance. We would ask for civility. We would try to handle it that way first and then go from that situation if we were needed to go any further with that. So, of course, I know that there's been conversations both at the municipal, county, state level on this. We'll just wait to see exactly what's decided.
And as long as you're still there, let me just ask, so we get these health orders from the State Department of Public Health. We saw those yesterday in the Jefferson County area. Who enforces that, who polices that, and what are the penalties if you don't comply?
The best way to answer that question is anybody, nobody, and everybody. The reason I say that, Debbie, is this. If the public health department issues an order, then that's usually enforced by the public health officer. There is some notations in law that you can have some basically, for instance, an interference with a governmental operation is kind of an open charge that you can use if somebody willfully disrupts a function of government. So there are some criminal, but it really depends on who has issued the order, what law that order is based on, because normally law enforcement, we enforce criminal law. Now you're getting into public health issues, public order crimes, even into civil law. So it could be one action that may implement something, then there have to be another agency that brings another action in order to further the enforcement of that. So we would just have to wait to see what is implemented, who it's implemented by, and what law that's based on.
All right, next question, please. Hal, I believe you're next.
While Sheriff was up there, I was going to ask him real quick, and then
Yes.
a follow-up with Mr. Malone after that. The jail situation, we heard from Sheriff Cochran over Mobile County yesterday talking about some measures they're taking there and considering.
Yes, sir.
What are some considerations, if any, you're making here for inmates, the load of inmates you have currently, those who may come in from here forth? What are the plans there?
And I appreciate you asking that question, Hal. We have done a lot. Number one, as I said, as I mentioned in my statement, video visitation, so we have no face-to-face or contact visitation. We are holding a lot of hearings now. Our court system has worked with us. So bond hearings, arraignment hearings, any hearing that by law we're allowed to do over video, we are doing that over video. Any individual that is coming into our facility that is coming from the civilian realm or not an employee of the sheriff's office is being screened. That screening is usually a temperature and observation screening. It could be followed up with more if there are any other indicators there. We're monitoring the health of our inmates. Today we had 544 in-house. We have 24/7 medical coverage in the facility. We're monitoring that very much because obviously it would be a great concern to us if we were to have any outbreak in the facility. And so that's why we've actually restricted access to some of our other sheriff's offices, because we have employees that go from office to office. So we're really concerned about any cross-contamination. Just because an individual may be in an office in Fairhope, well, they may actually end up being in the office in Bay Minette later in the day, or may go to our correction center. So that's why we've worked with the county on closing our facilities in areas other than just the jail, is because we are trying to alleviate any of that cross-contamination or furtherance of any of the virus.
Thank you. And Mr. Malone, if I could real quick, obviously you're in a very unique situation where, your primary focus to serve the community, the businesses, the tourism, make sure everybody has a great time while they're here, make sure they keep coming back. But in this instance, also a responsibility to make sure everybody's safe and healthy. The big question everybody's asking is, why are the beaches still open? Why are these big social gatherings on beaches still happening? And what is the dynamic there between Orange Beach having mostly state-owned, state park beaches, whereas Gulf Shores has city-owned property? What's that dynamic, and what would be that point where you said, all right, we've got to close the beaches? Well, number one, it's not my decision. It's not our organization's decision. We do communicate, as I said earlier, with all of our local decision makers. I don't want to be in their shoes. That's big decisions to make, whether it's in the city halls of Orange Beach or Gulf Shores or the Baldwin County Commission. All these elected people have a lot of weight on their shoulders right now. We will always follow whatever decisions are made at that level. So we're doing what we.
How serious
we-
have those discussions been at both the commission and council meetings you've been at?
Can't quote Mayor Kraft exactly. He said he didn't see, on Monday, he didn't see the beaches closing, at this point. And then, Mayor Cannon last night reiterated that the city of Orange Beach does not, the problems are, the city of Orange Beach does not have the authority to close, that would be the governor, if I understand that right, Hoss. And, the big gatherings of people being broken up, I think is on their minds, that that's the first thing they're gonna do to help maintain order. And again, the people that are coming, that's maybe 2 or 3%. The others are people just like us.
You talked about the takeout
Mhm.
services for restaurants, in Mobile County, I know it's a separate health department, Dr. Eichel just ordered, that restaurants not serve inside at all, period. I mean, they not have any customers inside. But that hasn't happened here yet, although the trend is that we want that to be the takeout. I mean, if that happens here, we'd have to hear from the state health department first, is that
Well,
what
it's
you're saying?
depending on whether you're talking about a mandate or a
Well,
recommendation.
this is from Dr. Eichel in Mobile County, they have a separate health department, he's just issued an order that,
Well, I know
they
several,
cannot serve inside the.
I know several of our restaurants have done that. They spread the tables out, they put more tables out on the outside. They're taking a lot of those recommended precautions.
But it could be a matter of time before it ends up being a decision made here.
So in regards to restaurants and the guidelines that are put forth, that will be information that will be coming from the Alabama Department of Public Health. And if we have Dr. Landers on the phone, she may be able to address some of those issues from Public Health.
Fingers are going as fast as they can.
Okay.
Okay. While she makes contact with her, is there an additional question? We can come back to your question.
I do, and I guess this would probably be a chamber question, could be a question for Sheriff Mack, but what about supply chains, grocery stores and supplies? We've all heard about seen examples of some of the hoarding, there are limits coming maybe for certain items, that kind of thing.
Mm-hmm. Okay.
I don't know of any limits that have been, put in place at this point in time. I think we're all, as you've heard from most everybody, kind of taking this, an hour at a time, actually. Not sure what may come down the road, just is gonna determine if, and I think a lot of the responsibility for this lies on our shoulders. If we, as Baldwin Countyans and people who live here and are visiting here, do what we're being asked to do, which is very simple. Stay home if you can. Stay out of crowds. Wash your hands. Use extra personal hygiene during this period of time. Do that, and if we can curb the spread of this virus, then maybe some of those drastic steps won't have to happen.
Quickly, she is.
Hold on one sec, Dr. Landers is ready to.
Okay, we have Dr. Landers on the phone to address the question that was previously presented regarding restaurants.
And can we also ask her if testing is imminent for Baldwin County? I mean, we don't have a
Yeah, we need to ask
testing.
questions. Yeah, I'll give her a follow-up.
All right, so while we're waiting to have Dr. Landers on the phone regarding testing and restaurant questions, are there other questions that you may have that our representatives here may answer?
There was Commissioner Underwood said something about a call center that was specific to Baldwin County. Do you have that number, or where can we find that number?
Baldwin County has a regular call center that's available for the county, and it's actually located in this building. They have a wealth of information. What is that, do you know the number, the direct number? It's like it's on our website, and several of our, if you call the courthouse, I think they're streaming them straight into our call center, and they have a wealth of information there. I'm sorry, I don't have the actual number in front of me. But it is on our website, and it's on our Facebook pages as well.
maybe a question for Mr. Hood. I don't know if there's been conversations with the Council on Aging or groups like that. I mean, I know some grocery store chains are looking at the possibility of having special hours for, seniors and for folks who might be able to pick up things for them because they can't make that trip.
Yeah, so the question is really geared around community. And what we have at EMA and what we have in place right now, and it's a good way if you want to plug in and be a part of a solution to the problem we're dealing with right now. We have a volunteer organization active in disaster. They convened today. They met this morning, and they coordinate with the state as well. The state has stood up VOAD operations as well. They're meeting primary needs. What we're seeing right now is our vulnerable population, individuals susceptible to the coronavirus, taking precautions, but they have daily needs like groceries or maybe a payment of a bill or something like that, specifically where they need physical transportation, someone to pick it up and get it to, from point A to point B. That kind of service is our greatest need at this time. Another thing that I want everyone to understand is the impact in our first responder community. They're having to protect themselves as well. And I just want you all to be mindful that our first responders are our front line, and we need to do everything we can to support them. Second, we have our first receivers. They are our true heroes right now. They're nurses, doctors, people that work in these clinics, everything from medical records to in-processing, out-processing, and right now maintaining their needs is important to us as well. So I mentioned the 7 critical lifelines, and one of those, or only one, that is yellow, and that's public health and medical, and we can achieve together getting that to green. I know one question previously I do want to address, if I can take a second, was geared toward supply for our local stores in terms of food and basic commodities that one would need day to day and the challenges getting that. Right now, our logistics community, our trucking line is extremely important and they're very active. Store hours have been altered to make sure that they are not only sanitizing the stores, but that they can get the appropriate stock amounts back on the shelf for you to purchase. So I'm confident that we will not have challenges moving forward if we all can take our standard precaution and abide by what the Department of Public Health has set for us.
One more question, real quick. I've been asked to ask about the number of hospital beds in Baldwin County. I don't know if that's something you're aware of, if there was a need, like say patients needed to be brought from Mobile to Baldwin type thing. I mean, is that available? Is that been talked about? Is that something?
Yeah, that's of course. So the question was about hospital beds and availability in our local healthcare facilities. One thing that EMA established was a constant communication, daily communication with public health, our local hospitals, nursing homes, and assisted care facilities. Extremely important to us. What we have and what we are seeing are very busy emergency rooms and also our clinics and our urgent care facilities, very busy. But not only in Baldwin County, statewide, our numbers are average to what they generally are during this time of year. What we're finding, in fact, in conversation and an update from the State Emergency Management Agency is we're right as we are and as we have been years previous to this. Right now, hospitals are still dealing with the flu. We did learn that, and we have to understand that as well. But right now, there's not any change or any issues or shortfalls in terms of beds for our local community.
All right, we do have Dr. Landers on the phone available to address the 2 questions that were presented previously regarding testing sites and restaurants.
Yes, this is Dr. Landers again, and first of all, thank you very much for being patient with the fact that I'm having to be on the phone as I am addressing multiple issues now with many different aspects of this response. You know, we're all concerned about this, and we all want to work together I'm a healthcare worker over 60, and my daughter's an emergency room physician, so, you know, we all have our own personal concerns, and we need to do what we can to reduce the misinformation out there, but also do everything we can to improve our education. So let's talk about restaurant safety first of all. Actually, had done some research on this a while back related to questions about food. If a person, first of all, if food is being served, at this point in time, food is not considered a vehicle for transmission of COVID-19. In other words, if you're preparing your own food, or if you are getting your food at a takeout, that's not considered at the moment a way to transmit COVID. Again, not transmitted through food. However, if you are an ill person with COVID, just as a matter of extra precaution, you should not be preparing food for other people. So again, food is not considered to be a vehicle for transmission of COVID disease. The next thing that I want to address is I think there was some questions regarding testing sites and testing kits. And I want to clarify this information for the audience. First of all, to remind persons that specimens are really what we're talking about. Specimens, nasopharyngeal or swabbed in the nose specimens placed in a certain type of material called viral transport media. Those are specimens collected from patients who have symptoms such as fever, cough, shortness of breath, and then sent to a laboratory, whether it's the Bureau of Clinical Laboratories with the Alabama Department of Public Health in Montgomery, or a commercial laboratory to be tested for COVID-19. So there's a difference in specimen collection and testing. The specimen is collected to be processed in a test, which has to be done in a laboratory. So I think the question comes up about sites to collect specimens. And again, many persons are working with this at the moment. There are some physicians' offices who are able to collect specimens at their office. That's statewide. There are different capabilities of physicians to do this based upon their office structure, their PPE, and their overall supplies for specimen collection. Hospitals, again, are also able to collect specimens on their patients that need to be tested for COVID-19. And finally, there is work being done, and there are sites being set up in different parts of the state to address specimen collection. In other words, a place where physicians or nurse practitioners might refer a patient who does not need to be hospitalized but needs a specimen because they have symptoms. There are also urgent cares that are doing specimen collection on their own patients and sending those to a commercial lab. So again, those are the answers that I have at the moment, and I'll be happy to follow up on any of that. Thank you.
All right. Thank you very much, Dr. Landers. At this time, we have time for one additional question.
Will there be a place
Hal
set
had his hand up
for-
first. Yes.
For the testing, these specimen collections in Baldwin County?
Dr. Landers, are you available to answer that question regarding testing sites in Baldwin County?
The question has been asked about will there be a site for specimen collection in Baldwin County? There will be a site either in Baldwin County or in extremely close proximity. With your being a large county, yes, I do believe that a specimen collection site to facilitate specimen collection, to assist the doctors, the nurse practitioners, and the hospital, as well as the community there in Baldwin County. Thank you.
All right, thank you. So with that, we are out of time for this press conference. I want to leave you with some important information. I wanted to share with you the phone numbers for the call center that we discussed earlier. The call center will be receiving calls and can answer lots of questions. I want to also let you know that the county is open for business. We are adjusting some of our services so that we can conduct services online, using drop boxes, through virtual operations. So there's a number of ways that we are continuing operations, and we are working together with our community partners. So to let you know, those numbers for the call center, for the northern part of the county, that number is 251-937-9561. If you are located in the southern part of Baldwin County, The local number for the call center is 251-943-5061. If you're located along the Eastern Shore, the phone number for the call center is 251-928-3002. I also want to let you know that we will be releasing a PSA, a public service announcement, later today regarding some of the efforts for the coronavirus. So be on the lookout for that. Thank you all for joining us. And before we close out, I would like to have Director Zach Hood close out the meeting.
I did want to offer some assistance in terms specifically to testing and testing sites. We do have capability to test within our area. So that capability is here. I just wanted to make sure that you had good, accurate information on that.
Thank you all for joining us.